Okay, so in today's video, we're going to look at bronchitis. Yes. So what is bronchitis? So bronchitis is the inflammation of the mucous membrane of the bronchial tubes, which may be acute or chronic, usually caused by bacteria, viruses, and also irritants in the airway, such as dust, smoke, industrial fumes. Yes, characterized by chest pain, cough, fever. Okay, so bronchitis often present as a cough, sometimes cough with mucus. If it's caused by an infection, fever will be present. Yes, so in order for us to understand bronchitis, we have to first understand the key terms in this definition. Okay, so what are the key terms? Let's identify the key terms in the definition. Okay, so if you look at the definition, we can see inflammation. Yes, inflammation. So for the sake of those who don't understand what inflammation is, so inflammation is simply the body's response to infection, injury, or irritation, causing pain, swelling, redness, heat, and the loss of function. Yes, so apart from inflammation, we also have mucous membrane. Yes, so mucous membrane is also known as mucosal lining. Yes, so mucous membrane is a protective layer that lines cavities and internal organs in the body. Yes, so you can find mucous membrane inside your nose, mouth, lungs, throat, and other parts of the body. Okay, so next we have, let's see. Okay, next we have bronchial tubes. Yes, so the bronchial tubes, these are the large tubes that carry air from your trachea, the windpipe, to the lungs. Yes, so apart from the bronchial tubes, we have acute and chronic. You need to know this also. So acute and chronic, I'll start with acute. So acute, these are severe illnesses that develop suddenly and they last for a short period of time, often only days or weeks. Yes, so examples of acute conditions such as severe injuries, broken bones, asthma attacks, heart attacks, and more. Yes, sorry about that. So when it comes to chronic, chronic conditions develop slowly and may worsen over an extended period of months to years, or even a lifetime. So examples of chronic conditions, we have cancer, diabetes, HIV, yes, and more. Okay, so let's go through the definition again. I'm sure now you have an idea of what bronchitis is. So let's go through the definition together. So we said bronchitis is the inflammation of the mucous membrane of the bronchial tubes, which may be acute or chronic, usually caused by bacteria, viruses, characterized by chest pain. Sorry about that. Characterized by chest pain, cough, fever. Okay. Some of you are seeing this for the first time, so I'll try my best to make you understand. So if you look at the definition, the first part of the definition, it says bronchitis is the inflammation of the mucous membrane of the bronchial tubes. So I want you to understand this part. So let's try to understand this part. So the mucous membrane is also known as the mucosal lining, right? Yes. So the mucous membrane is a protective layer that lines cavities and internal organs. So if we look at the bronchial tubes, those bronchial tubes, inside the bronchial tubes, there is a mucous membrane. So now imagine if this mucous membrane is infected by bacteria or viruses, or maybe there is an irritation such as smoke, dust, this will lead to inflammation. Remember, inflammation, we said it is the body's response, how the immune system or the body responds to infection, injury, or irritation, leading to pain, swelling, redness, heat, or loss of function. Yes. So most of the times, bronchitis is caused by an infection or irritation in the airway. The presence of an irritant like dust, Yeah. Okay, yes. I was saying the presence of irritants like dust, smoke, or infection can lead to, actually not can lead, but will lead to inflammation, which narrows the airway, making it very small. Yes, it can also increase production of. They can be also increase the production of secretions, which will further disturb the air passage. So irritation of the respiratory tract will lead to cough in attempt to clear the airway. Yes. So sometimes it can also cause chest pain, feeling a slight pain behind the sternum. Yes. Okay, so this is just the introduction part of the topic, but in the next video we are going to look at this in details. So we are going to talk about the types of bronchitis, pathophysiology, causes, signs and symptoms, diagnosis, and management. Yes, so but for management, I'll do a separate video for management alone. Okay, so I think we can end here. Thank you so much.